Hey you guys, it's Thursday the 13th. Yep. I just wanted to hop on and talk to you guys for a little bit. I had a new subscriber ask me how to negotiate pay as a new Peon in the field. Some places just have a starting base rate of what they want to pay you, so right out of the gate, starting pay is going to be 15 an hour. That's like my first job. 15 an hour was their baseline. That's what you start out at. And then some companies do like a yearly evaluation, or they do a 6-month eval, and you get a raise at each evaluation. Here, where I'm at now, they took my CNA experience that I had before becoming a nurse, and then along with my other nurse experience, and compiled that, I guess, as skills that I maybe acquired during my other jobs, and that's how they came up with my base pay of $16.75. So it really just depends where you go and how their rules and protocols are for starting pay. Sorry for the noise in the background, that's my air unit. I don't know if I told you guys my AC crapped out, but it finally fully crapped out. So I have to save up to buy a new unit. Pretty sure I already told you guys that, but yeah, so I got home from work. Well, after work, I went to the grocery store. I just got home, put everything away, and just thought I would hop on and like talk to you guys. So I can always tell who I'm working with, like running the front and stuff like that, by how the day goes. And yesterday and today was very hectic. It was very unorganized, and it was frustrating. And it wasn't just me, it was the other nurse as well. So basically, when people were coming in to be checked in for their appointment, it was taking them forever to arrive them in the system, and it got a lot quieter now that that's shut off. It took them forever to arrive them in the system. So the doctor I work for, he's very particular, and he wants to see his patients as soon as they come in. So I watch the schedule like a hawk along while I'm sending him medication refills or faxing stuff to other companies that need it for patients and what have you. I'm constantly watching the schedule. So when they're arrived, I go to the waiting room, call them back, get their vitals, and do intake, and then he's good to go. He can go do his thing. And it seems like today and yesterday, it took them forever. And when I would watch the schedule, like someone would show up for their say 11:45 appointment. So I would go bring them back, and then when I would bring them back, the people for 10, 10:15, and 10:30 would be checked in as well. So I would have 3 people arrived after the one person I just roomed. So that was very frustrating. And then the thing that really frustrated me today was paperwork is very essential where I'm at, because it is family medicine. So we monitor people with conditions like heart failure or end-stage renal disease and COPD and all kinds of issues, diabetes, and we have people on hospice. We have people that are trying to get their insurance to pay for things like walkers, hospital beds, Lantus, all kinds of medications. And when one person lets something fall through the cracks, it essentially falls back on me, the nurse, because whenever a patient comes in, it's like, oh, I want to speak to the nurse. I gave it to the nurse. I want to talk to the nurse about this condition or this medication. They never want to really talk to, just front desk personnel, because they feel maybe that, they don't know their whole history, or they're not qualified, which some of them are. So it's just very frustrating when paperwork gets lost or it doesn't get faxed over in a timely manner, and a patient doesn't get the item they need, like a hospital bed or walker or a medication that they need. So basically, I made up my mind today, instead of giving the faxing paperwork to the secretary, because that's primarily their job, I'm not doing that anymore. When something needs to be faxed or scanned, I'm doing it myself. That way I know if something fell through the crack, it's going to be me. It's going to be all my fault. Not trying to trace back who had it last, why it didn't get done, all of that jazz. It's just, oh, I forgot to do it, or nope, I guess it didn't go through. No, I didn't check on it. It's my fault. Boom. It's that simple. But you can just tell how the day is going to go. The mornings are always very busy for us, because we usually typically see more patients in the morning. The afternoon after lunch is kind of just relax. And you could just tell who's working because it was just chaos today. It wasn't even 11 o'clock and I already had a headache brewing and I was just like, this is ridiculous. Like, it wasn't like this up until the last like 2-3 days. So what's the problem? And then you have, drama and issues going on with other units throughout the facility, like, front desk or checkout, whatever. They have their own thing going on and they have their own issues with some people they work with. So you're always going to have somebody, a team you love working with, the dream team. And then you're always going to have people that it's like, oh, cool, they know what they're doing. Then you're always going to have the people that it's like, oh my gosh, why am I working with this person today? You're always going to have that. And it's just frustrating. But at least today wasn't a Monday. And at least it wasn't a Friday, because if it was hectic on a Friday, that's kind of going to put a damper on the weekend. And I don't want that. It's the weekend. I want to relax. I want to have fun and be happy and just crazy. So just thought I'd update you guys on that. We've been hiring some new people. One of them didn't work out. She just didn't want to come back to us, which, hey, it happens. It just puts a damper on the rest of the scheduling because we have to fill in for other people. But I've been doing a lot of testosterone shots, B12 shots. I've been giving a lot of Prevnar 13 and pneumococcal 23 vaccines. And the patient is supposed to receive the Prevnar 13 and then come back and get the pneumococcal 23. You're not supposed to give those both at the same time. And then, what else have I been doing? I got to assist with a skin tag removal. It was a pretty big skin tag. So that was cool. I got to watch that whole procedure. And I got to kind of help him and hand him his tools. That was fun. And then, what else did I do? It's just mainly a lot of paperwork. Paperwork is the most frustrating part of being a nurse. Like, no lie. You have to make sure that the paperwork that is sent in by companies or family members or the patient, you have to make sure it's filled out and given to the correct people in a timely manner. Because, like today, I had quite a few second, third, fourth attempts coming through, and I'm like, I never received this. So I don't know if the company is just saying that so that it's expedited and it gets filled out quicker, or, if someone didn't give me the fax, or if the fax got lost in cyberspace or whatever, but it's just frustrating. And, yeah, I also have to do a lot of prior authorizations. So a patient, when a doctor prescribes a certain medication, they might want them on something, and I have to do a prior auth through their insurance to make sure that their insurance is going to cover it. If their insurance does not cover it, the patient can contact their insurance, or usually I do it and just say, hey, what alternatives can my doctor prescribe this patient that you guys will cover? And then I go from there. Sometimes the patient doesn't want to do what's covered because it's not the exact prescription that they wanted, or it's not going to work as well as the trade name, because generic and trade, they have different names because essentially they do the same thing, but the ingredients are a little bit different. One might be stronger than the other and vice versa. So a lot of times the patient does want the brand name, not the generic, because, they see the commercial for it or they hear about it from someone else and they don't want the generic. But a lot of times insurance will cover generic medications, and that's a lot better for the patient because then you're not paying out of pocket for anything. And medication can be expensive, especially depending on what it's treating. So yeah, I do a lot of prior authorizations. I do a lot of phone calls. I have to do hospital follow-ups. If a patient is in the hospital, I have a little questionnaire that I will call and talk to them and ask them all kinds of questions to make sure that they're getting the care they need at home. I have to update their medications if the hospital gave them any more new medications. And usually they have a follow-up appointment within the next 2-3 days, sometimes the next day. It just depends on the provider. So when they come in, we just want to make sure that they don't have any major concerns. And sometimes if they come in from the hospital with something new, like a trach or G-tube or colostomy, we want to make sure they know how to take care of it. We want to make sure that they know the precautions to take with that, and we need to also know that they know what signs of infection look like, or how to use the device. So I really like my job because we kind of monitor a patient's condition all throughout the stages of it. It can be someone just got diagnosed with cancer and we're making sure they're seeing their oncologist, and they're also following up with us for, a comprehensive metabolic panel, or we're checking their lipids and making sure that their cholesterol is good, along with them receiving chemo or radiation. We'll give referrals if they get an x-ray at our facility or blood work comes back and some of their counts are too high. We'll refer them to oncology or urology, wherever they need to go. So it's really good to see a patient progress and we get to treat that illness. We also get people coming in for minor things like just a sore throat, or I have kids come in for ADHD, or they need their shots for school. I also give a lot of HPV vaccines to teenagers, and male and female, and Depo-Provera. We also do like pap smears. We do everything, and that's why I love my job, because there's never a dull moment. I'm always learning something new, and I'm still fairly new to my doctor, so we're kind of still getting in the rhythm of how we like to do things. And he's so easygoing that when I don't know what I'm doing, he never really corrects me. He'll just be like, "Oh yeah, you did great," or he'll come up to me and be like, "Hey, I like to use this." So today we had some type of injection that I had never done before. A trigger point injection, I think it was called, and I had never heard of those before. So when I saw that on the schedule, I was like, oh my gosh. So I just went to the cabinet and in the lab and got everything ready for him that I would for like a cortisone shot. And he did end up using the needles and syringes and everything that I took out, but of course the medication was different. So basically what they do is he explained a trigger point injection as like if you're massaging someone and you push your thumb and you're trying to get the knot out, when he injects the needle into that knot, it dissipates the knot and it goes away. So he did that for someone, and I thought that was really cool. Like I was like, I've never heard of that before. That's pretty awesome. So that's something new. What else? I have some more training coming up that I have to do in July for like patient type stuff, like customer service, which to me, I myself, when I'm nursing, so I go by the vibe I get from the patient. If I feel like the patient just doesn't want to be there, they want to get it over with, I get them in and out. I'm just like, okay, hi, I'm Amberly, I'll be taking care of you. Let me go ahead and get your vitals. What are you here for? What are your major concerns? Blah, blah, blah. If they're, chill, laid back, I'll talk to them, get to know them, ask them all kinds of stuff. But you can always go by someone's body language, their vibe, how they talk to you, how they respond to you. So that's what I go by when I'm in the room with the patient. And typically it's been working out pretty well. And everyone keeps saying that they hear nothing but good things about me. And I'm just myself. You know what I mean? So that's it. I don't really have anything else to say. If anybody has any questions, you can ask. I'll stay on for a little longer. My battery's dying. Oh, okay. So I usually don't post my live videos, but I'll post this since you're in a Wi-Fi area and it's really loud there, so you can hear it. I will be starting the LPN program in the fall. I'm not good at math at all, nervous about the dosage calc part. Do you actually use this or have to convert dosages with your job? So, I do not have to use dosage calc at my current job. Do not worry about your dosage calc class, because the way I look at it, I suck at math. Like, I'm horrible at math. When I tell you that this girl right here took like 2 or 3 years of high school algebra, yeah, I know, it's horrible. Like, what? How are you a nurse? I viewed dosage calc as, oh my goodness, this is math I'm going to need to save someone's life or to give medication to someone. And it's not hard at all. I went to a study group that me and some of my classmates formed, but basically you're going to have dose over hand times volume. Those are the two main I was going to say ingredients like a crazy person. Those are the two main equations that you're going to need. There's dose over hand times volume, dose over hand, and I want to say there's one more, but I can't remember that off the top of my head, but I have all of my notes. So if you need any help with dosage calc, you can ask me, or you can do a study group, or if your teacher or instructor offers tutoring, or if the school offers tutoring of some type, you can go to that as well. But it really wasn't that hard. And at the end of the class, we had to take like a exam with, I think there was like 50 questions, and they were worth 2 points apiece, and you had to get a 100 in order to pass on to the next class. It was so easy. It was so easy. Drips. You're going to learn drops per minute, which is GTT. I don't remember the equation for that one, but most places now, especially since everywhere is electronic, most places are just going to use electronics and have it calculated for you. And if you're ever at a job and you don't know how to calculate the dosage of a drug, go ahead and have another nurse help you, especially starting out. Even now where I'm at, these testosterone shots or any vaccine, unless it's the pre-filled one like Prevnar or Tdap, I have another nurse verify, okay? This testosterone shot, he's getting 400 milligrams. There's 200 milligrams in one vial. So 2 vials equals 400 milligrams. So when I draw it up in the syringe, I want them to make sure that I have 2 milligrams. And I always have another nurse check me. And they're like, why do you do this? You know what you're doing. It's not about that. I want you to verify that I'm giving the right drug, the right dose, to the right patient. Don't ever be afraid to ask questions. I'm still asking questions, and a lot of people are like, oh, how long have you been a nurse? Like 5 years. No, August will be 2 years. Like, I'm still fresh out of the gate, technically. Like, there are still some things I don't know what the heck I'm doing, and I go to the more seasoned nurse, and they're like, oh, that's easy, let me show you. And then because I am the hands-on learner and they show me and let me do it, I learn it, and I'm like, okay, cool. Like, I learned it. The hardest thing for me with the testosterone shots here was learning to document it in the little binder that we keep locked up. That was the hardest thing for me, because I'm used to, okay, give them the shot, document it in the computer, keep it moving, especially on a busy day when there's tons of nurse visits, people coming in for T-shots, blood pressure checks, PPD readings. It's crazy, okay? But dosage calc really was not hard at all. My book was only about that thick, and we used that book for homework only. Our teacher taught us the main equations we were going to need, and that was it. I will tell you, the part I struggled with the most in dosage calc was pediatric equations. Just because you have to use their weight, which most of the time the questions require you to find out how much they weigh in kilograms times their actual weight. And then you have to do like the dose over hand times weight or volume. And it just gets really, I call it hairy. It gets really hairy. It gets really complicated. And I just don't like pediatric dosage calc, which is one of the reasons I didn't want to work in peds because you will use that. So no. There is one drug that we would have to calculate, but it's like Rocephin injections for gonorrhea. I believe that's what it is. You basically, there's a sheet and you take a ruler with like the patient's weight and height or something like that, and then you figure it out. I never had to do it at my OBGYN job because most of the time when the patients were coming in, they had already had gonorrhea and we had just had to draw it up. Or I would have another nurse that has done it before show me how to do it, but then every time there would be like 3 or 4 of us trying to figure out to make sure we were giving them the right amount of antibiotic, because you don't want to give them too much and you definitely don't want to give them too little, because then they're going to keep the STD. So always ask questions if you need to ask questions. Was learning this to start an IV difficult? Also, you do blood pressures manually or with an electronic machine at your job. I've been a CNA for 4 years. Starting an IV, I loved it. Or to do anything like that, or even like discontinue an IV. I love doing stuff like that. So it wasn't hard at all. Most of the time they already had their port in their arm, and you basically just get the tubing and hook it right into the port. Because the RNs, when we did our hospital clinical, had already had the patient hooked up, and they would be like, oh, well, they need a new IV tubing, or they need a saline drip. So, you know, our clinical instructors would let us do all of that. What else was I going to say? Oh, your primary drug when your patient is in the hospital and they have the IV pole, the drug that is most important that they need to get into their body is going to be closest to them. And then the secondary drug, which could be like, say they're on an antibiotic, and it's in the bag, it's going to be closest to them, and then their saline drip is going to be hanging higher. And that's why when you're in the hospital and you see them walking around with poles, the bags are at 2 different levels, because one is their primary, and that needs to be in their body stat, and then the other one is just kind of there to keep everything moving and just give them electrolytes or help the antibiotic flow through their body or what have you. So the other part of your question, yes, we do manual blood pressure. I cannot stand electronic machines, because if they are not calibrated, if it is not calibrated, it can be wrong. So when we have patients come in at a nurse visit for blood pressure checks, we ask that they bring their electronic machine with them so that they can compare what we get manually to theirs electronically. And sometimes, you know, their readings at home will be 160s over 90s or 100s, and then when they come in, hey baby, get out of the way. Get out of the way. Go. Sorry. Remington. Go. Come on, go. Come on. Sorry. So when, are you serious right now? Go get it. So, this is the funniest thing ever. Go. You're so funny. Go. I don't even know what I was saying. Oh, so then when we take it manually and we get, you know, 128 over 74 or 82, that's how we gauge and judge. Manual is always going to be more accurate than an electronic reading. If you can't hear what you're listening for, I don't know what type of stethoscope you're using, but I had an MDF instrument one and it worked fairly well. But when I got this new job at this awesome company, I decided to treat myself to my first Littman, and I can hear everything. I can hear, go, Remington, go, honey. I can hear everything. Like if they have a murmur, if they have wheezing in their lungs, if they have any type of like bronchi, anything going on in their chest, I can hear that in their vein when I'm taking their brachial blood pressure. Yes. So if you have like a stethoscope your facility provided you with, sometimes that just comes in like a bulk kind of company buy, and they're not the greatest quality. So you definitely want to invest in a good quality stethoscope, especially if you plan on working in cardiac or NICU, PICU, anything like that. You definitely want a great stethoscope. What are you doing? You look so cute. Using a Littman, maybe it's just me releasing too fast. Yes, so you definitely want to release it at a slow pace. Don't rush yourself when you're taking blood pressure, because blood pressures can be crucial. Also, make sure the cuff is placed properly, and definitely make sure you're releasing it at a good speed. And also, if you can always have someone check behind you if you feel like what you're hearing isn't valid, isn't good. Also, make sure that when you're taking it, that there's no distractions in the room. There's no family members talking to you, the patient's not talking to you, there's no TV on, no radio, no noise in the hallway. If you have to shut the door to take it, do it. That's why I love my job, because every room, I do intake in the patient's room. Every pod, they have 3 rooms to themselves, and I take the patient in the room, I'm on the computer doing vitals, updating their chart, updating their medications, doing everything I need to do, and it's me and the patient. We have one-on-one time. And it's great because when I'm taking their vitals, it's quiet. And because my doctor is fast-paced, I don't do a manual pulse. I have a pulse ox, but sometimes if the patient has a murmur or AFib, you know, their heart's going to beat a little different. Or if they have palpitations or anything going on, and I know it when they come in, I'll do a manual just because it's going to be a different reading and the pulse ox will not be accurate. Someone else asked another question. Does it make sense to get a Littman for LPN school? It is up to you. If you feel like LPN school is for you, you are going to love being a nurse and you're going to invest your time and effort into making a great career out of nursing, absolutely. A lot of people I know, once we passed like the general education courses, like our prereqs, like anatomy and physiology, and we took our first nursing classes, they treated themselves and bought their first Littman for clinical when we were about to go to our first clinical rotation, and they've kept it, you know, all throughout the program, and they probably still use it now. I don't know, because they're expensive. But I wish I would have brought mine home so I can show you guys mine. I had mine engraved with my name, comma, LPN. That way if anybody grabs it and they say, oh, I don't know who took it, I can go around looking for mine, and my name is on it. So I got that on sale, shipping and everything. It was like $141. And mine's a Littman Classic 3. So if you feel like you're going to make a great career out of nursing and this is for you and you love it, go for it. I just got an acceptance letter yesterday, so thank you for the advice. Yeah, congratulations. You should be excited. It's going to be very hard. You're going to want to cry. You're going to want to pull your hair out and scream. But it is completely worth it. How do you feel about working in long-term care facilities? I loved clinical and long-term care because that's basically where we did our clinicals. The only reason I don't work in long-term care, and this is the honest truth, is because throughout nursing school, we would get assigned patients, and some people had patients that had G-tubes, PEG tubes, or trachs. I never received those patients, so I don't feel comfortable. I got to assist like 1 or 2 times with a PEG tube feeding or a G-tube feeding, a bolus feeding, and like I wasn't nervous about it. Like I was like, okay, cool, this is what I do. But I just didn't feel comfortable working in long-term care, not having the proper skills to take care of patients who have a trach, G-tube, whatever. And facilities will provide the training for it, and you know, they'll check you off, make sure you're comfortable with it, but I just didn't feel comfortable with it. And I love geriatric patients with dementia. I love helping take care of geriatrics. I was a CNA for 3 years. Like I loved it. And where I worked, it was assisted living, and then the other side of it was the locked memory care unit. So we never really had to deal with people who had trachs, G-tubes, PEG tubes. We had, you know, wound care nurses. When I was a CNA, we had wound care nurses taking care of their wounds, or if they had any type of tubing, you know, other companies like hospice companies or home health companies were coming in to do this for the patients. It wasn't us. So as a CNA, I never even got skill sets for trach, G-tube, or PEG tube. So I'm just not the most comfortable with that. And that's why I chose not to work in long-term care, but clinical-wise, I loved it. I loved anytime someone had a patient that was more difficult or had something wrong with them that I never was assigned to, I was in the room right there with them to see how they dealt with that patient and how to care for them. Because if the situation arises where I needed to do it, you know, I would at least like to know kind of where to guide myself and how to get it done. So when you do clinical and you start doing like your book like homework and all your reading in the book and learning about the different types of nursing care there is and nursing facilities and types of things you can get accredited for in nursing, you'll find your niche. That's why so many of us loved OB and like labor and delivery because that was the best unit ever. But I got out of that because it was stressful. It wasn't delivering babies. It was taking care of them antenatal and intrapartum, or antepartum and intrapartum. You know what I mean? So that was different. Assisted living is pretty easy. Would working as an LPN there make you forget skills that you maybe have to do because the residents are not too sick? You never really, I don't know. You'll never really forget skills. You'll just need to be refreshed on them. Like once you, like if you're in assisted living and nobody has G-tube or trach or anything like that, and you want to work as an LPN there, the only reason that when I went to nursing school I didn't go back to where I was as a CNA is because their top pay there for an LPN working the med cart was like $18 an hour. And yeah, I'm not making that now, but I'm also acquiring more skills and actually putting the skills that I learned and paid for and am paying for from nursing school to use today. I love hooking up EKGs. I love doing manual blood pressures and giving vaccines and educating patients on diabetes, or, you know, going over lab work with them, or letting them know that we are there for them if they need to vent to someone, or, you know, I'm putting all of my skills to use. You don't ever really forget a skill. You'll just need to be refreshed. So, like when I first started there and I had to give my first Depo-Provera birth control injection, I was like, oh my gosh, I haven't been an OBGYN in like a year. Like, what do I do? And I was like, oh, the amount for such and such, it's 0.5 ml. And they're like, yeah, and you give it to them in the butt and they're good to go. So you have to work where you're comfortable. If you're comfortable and you love your job right now as a CNA/med tech at the assisted living facility, you can talk to them if you're in school, if you're thinking about going to school, and just see what they offer if you were to go back for education. Do they offer tuition reimbursement? Will you get a better pay? What skills can you acquire? And if they have sister properties, you could see if they have a different unit where it's like a long-term care unit, and you could put your skills to use for trach, G-tube, wound care. You can get certified in wound care as an LPN. You just have to find the right place that will do it. I went to school, I think there's like 2 or 3 of the girls now out of my class, they are wound care certified LPNs where they work because they work in a long-term care. So you never forget a skill. Everything eventually comes back to you, especially when you apply yourself fully in clinical. A lot of people like to play around at clinical and not really do the things that they're supposed to do, or they shy away from things because they're scared or nervous because they've never done it before. For me, I want to know what the heck I'm doing. So, like the first time I helped do wound care on a Halo device that was on his lower leg, I was like, oh my gosh, I've never done this before. What do I do? And luckily the RN that does the wound care training for the other RNs in the hospital was teaching us. And, you know, she was like, does anybody want to take a toothbrush and get the scabbing off of where the bars come out of the leg before they place the new stopper on. And she's like, who wants to do that? And nobody jumped at it. And I was like, hey, I will. So you put, you know, sterile water and you just kind of brush it like a toothbrush around the scab, and then the scabbing comes off, and then you place the new stoppers on with like Teflon. You cut it and it just fits right on there. And I was like, oh, okay, I know what I'm doing now. A lot of people didn't want to jump in and do the hands-on stuff. So I love doing hands-on. Nursing, I've said it before, it's like 90-95% hands-on. If you don't know what you're doing hands-on wise, it's going to be a little harder for you. You have to be a people person. You have to know how to talk to people, especially people with disabilities, or people who are shy, or people who are grumpy. You have to know how to handle certain personalities. And nursing, to me, I used to never, in high school, I was never this way. I was never happy-go-lucky, outgoing, bubbly, I'll talk to anybody type of person. I stuck with my clique, and I would be goofy with them, but around strangers, I would clam up. Now, I don't care what anybody thinks about me. I'm crazy, loud, outgoing, whatever. I'll talk to anybody. In the grocery store today, I was talking to the lady behind me for no reason. Oh, her shirt. I liked her shirt, and then we just carried on a conversation until I checked out. I mean, I love talking to people, any people. So yeah, that's that. Has something in my eye. But yeah, you never really forget skills. Why do so many students fail anatomy the first time? So, it really depends on the anatomy that you're taking. I took anatomy with no physiology. At my community college, if I was to go back for my bachelor's, which I am considering, I would have to do anatomy and physiology. Physiology is the part that usually gets people at my community college. Anatomy, if it's a part of your prereq in your short-term nursing program, if you're going to accelerate it and it's like 14, 16 months and it's just anatomy, a lot of people fail it because everything you're learning in a 14 or 16 month program is you're learning all of this in like 4 or 6 weeks as opposed to a normal 16-week class. My phone's about to die, so I'm going to go run and get my charger. Hold on. This is the funniest live ever. Oh, I don't want it to die. All right. Okay. Great. So, I'm back. We're live. We're still live. Ugh. I just have to plug my phone in before it dies. A&P is not that bad. It's just memorizing body parts and function, but it is manageable. Yes. So, if you wanted to start with okay. I need something to set my phone on because this is weird. But if you wanted to start with an intro to A&P, I would recommend that because that's what I did at my community college before I was going to take anatomy and physiology for the nursing program until I changed my mind. I'm just looking for something to set my phone on. Pulling my coffee table over here. Okay. Beautiful. So, yeah, if you wanted to take a beginner's course intro A&P, I highly recommend that because you'll definitely learn the basics of A&P and kind of how physiology works. My LPN program, we basically just learned anatomy, like what this body part is, what it does, the essential functions, and that was it. We didn't go deep down into physiology of why the heart does what it does or why there's so many muscles in the leg, And the reason why I really... Sorry. Is my phone charging? The reason why I really... The reason why I really condone going... Okay, so if I do go back for my bachelor's, that is why I'm going to take the long route. Because I want to take my time learning the things that I need to learn to receive my Bachelor of Science of Nursing. The Fast Track LPN, the 14, 16-month course, you're learning everything so fast that you do brain dump after classes. There's certain things that you're never going to remember. There's going to be classes you take and it's like, holy crap, I passed, but what did I just learn? You're going to have teachers that don't teach you correctly or don't teach you enough or don't teach you at all and you have to teach yourself and say you pass that class by the skin of your teeth and you're like, holy cow, how did I just pass that? Why is that not charging? So weird. You're gonna be like, how did I pass that? And you pass anyways. So you might not learn anything from the classes in a fast-paced course or program, but you still pass. And just like with every job, even if you get a bachelor's, you're going to have to start over when you work for a company because you have to learn everything those companies want. Yes. So, another question. A&P2 is hard. Yeah, A&P2, I have heard that is so difficult. Did you have to work full-time while in school? I will have to still work full-time every Friday, Saturday, Sunday, and I'm afraid I will get burned out. So I want to make sure my phone is like charging. Okay. So when I first started nursing school, yes, I was working full time all day, going to school at night 5:30 to 10:30 p.m. and 12-hour clinicals on the weekends. My boyfriend at the time, who was in the Navy, jets. My boyfriend at the time, who was in the Navy, was making decent money, and he was like, you know what, you need to focus on your nursing career. So, and excuse me, we really didn't have like a dating life. Like, he was at work all day, going underway. I was at work, school all night. We didn't really have a dating life. You know, we never had time together. So he was like, you know, I make enough money to pay all the bills. It'll be tight, but we can do it. He's like, I would rather you be happy and go to school all week, and then I'll be able to come home to you and we can spend a little bit of time together after you're studying, and then you won't have 12-hour clinicals on the weekend. You'll just go to clinical all day from 8 to 4:30 or 5. So I ended up switching from full-time working to night classes to going to school 5 days a week. And it was good for me because when I first transitioned from that, I was still working, you know, every other weekend, making a little bit of pocket change here and there for me and him to have fun with or whatever. And then eventually I was like, you know, I don't need to do this because we're making it. So I asked him if I could quit my jobs completely, and he said, yeah. Gas in your car or pay your rent, whatever you have to do it. You can always adjust your schedule if need be. Another thing you can do is there were days during certain semester, like quarters, that we would have off because of holidays or just the teacher had stuff to do or it was a half day. When my schedule came out for my next class, I handed it to my job and I was like, hey, I can work these weekdays and still keep my every other weekend. Or I went PRN basically. So whenever they needed me on a weekend and I felt like working, I would work until I quit. So there's always an alternative for you. You can always figure out, you know, how you want your work schedule to work. And another way to make money while you're in school, you can blog about your experience just like I have. I mean, I haven't made tons of money, but you know, you can share your journey. You can start a blog. I have a blog on blogger.com, and it's called This Thing Called Life. And I haven't really blogged on it that much. I've been expressing my depression and anxiety and weight gain issues on that blog now. But other than that, you know, all of my nursing school stuff is still on there. I was sharing my videos on my blog for people who were reading it, and you can find a hobby you like to do and sell your crafts. Or some people sell paparazzi jewelry now. That's like the big thing. You can even do that. You could try to get Pell Grants for school. That way you can not have to pay that money back, and that's less amount of money that you'll have to pay on a student loan. You know, there's always stuff out there. If there's tuition assistance, there are all kinds of things that will help you. And you can always talk to like your financial advisor, financial aid advisors, or a counselor, and they will help you kind of guesstimate, you know, how much money you're going to need for school. You can sit down. I made a list of all of my bills and basically starred which ones were essential, which was rent, power, and my car. I didn't care about my cell phone because at school I had the computers I needed for all of my projects and Google and whatever. So if my phone got cut off, so what, you know? But like I said, luckily my boyfriend was able to provide for both of us. We really had to budget, but we made it, and it was all worth it. Because now I have a boyfriend now, and he helps me pay the bills half and half. But if we were to break up, I'm financially stable. I can pay all of my own bills. I don't have to rely on anybody financially. Yeah, so I did LPN before RN just because I wanted to get in the field. I wanted to see if I liked it, and I love it. And eventually I would love to get my BSN, maybe even my master's to teach nursing, because I feel like that would be great, because I could help mold the future of the future nurses and really get to mingle with people and teach them that nursing isn't just a job. Nursing is a work of heart. You know, I see those shirts everywhere, and it literally is a work of heart. If you don't have compassion to care for other people or care about the well-being of others, you don't need to be a nurse. You know, I see so many nurses, especially when my dad was in and out of the hospital, they had attitudes, they were snotty, basically because they were there for a paycheck. You can tell, you know, and then when people come in and see me, they're like, oh my gosh, no nurse ever talks to me as long as you, or if I was to cry to someone else, blah, 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 you know, it's like, that's what I'm here for. You know, when I go to work, yeah, today felt like work, but most days it's like, if you love what you do, you'll never work a day in your life, and I don't feel like I'm at work until I get home and I'm like, wow, I'm exhausted. Like, what did I do all day? Oh, you know, I saw 15, 20 patients. And at the end of the day, especially when I'm leaving and pulling out of the parking lot, I'm not stressed out. I think about patients that I saw that day that have ailments like failing livers or liver rejection or diabetes, or they have cancer, or you know, things that really touched me that day and hit my heart. I really pray for them and I just think of them. So if you don't care about people, if you don't care about the well-being of others, do not be a nurse. It's not all about the money, and people can tell. Patients can tell when you're just there for the money. And it shows through your work too. So, let me see. Exactly, that's the part I'm nervous about. I have an 8-year-old and I work full time. I want to quit and try to grind harder on eBay, but I'm already working at a major hospital, so I will have to see. So if you're already working at a major hospital, that's actually really good for you, because if they accept LPNs on any type of floor, like med surg or whatever unit, your foot's already in the door. So, you might want to just like, I want to quit and try to grind harder on eBay. You really just want to try and make it work the best you can, especially since you're at a hospital. And you should look in to see if your hospital has tuition assistance, or if they will work with your nursing school schedule. The best thing to do, and this is what I did before I actually started nursing school, I went to an open house. I took my placement test, I got accepted, and I let my job know, like, hey, because I was a CNA, hey, I got accepted into LPN school and I'm going to be starting on January 24th, 2015, I think I started. So my schedule is going to need to change in the future. For now, it's just Monday through Friday, blah, blah, blah. And I told them, you know, I'm going to be going at night, 5:30 to 10:30. So I was working days, 7 to 3, and I told them, you know, I can't stay late. I won't be able to cover anybody's shift Monday through Friday because that's when I'm going to school. And they were like, okay. And then when my boyfriend decided to take over and pay all the bills, I told them, you know, hey, I don't really need to work full-time here anymore because I'm switching to day school, so I need to go to PRN status within the next 2 weeks when my next semester started, and I was going to be a day student, and that's what I did. And it all worked out. Thoughts on fundamentals part in school? Heard it was difficult. Fundamentals of nursing, like how to be a CNA, like transferring patients, how to give a bed bath, how to use basins, how to use a bedpan. That's what our fundamentals was about, and it was easy for me because I was already a CNA, and it basically felt like I was doing my job. And then when we had skills check off, you know, we made it fun because we would be the patient in the bed and they would have to transfer us from the bed to the wheelchair or put the bedpan under our butt. So we just made it fun. Fundamentals wasn't difficult, and any classes that you guys take and you need help, you can always ask me on here or find me on Instagram and ask me your questions on Instagram. I can't link it right now, but I'm on Instagram and you can find me at Amberlee, AMBURLEEE. And you can ask me questions on there and follow me on there because I'm not really on Facebook that much anymore. It's getting old. But any questions you have about any classes that you're taking that I've already taken, I will gladly help you. If I can't help you, I'll get my book out or my notes and find it in my notes for you. Because I've been through the journey. I know it's hard. I know you're going to want to give up at some time, but don't do it. It's not worth it. The end result of you graduating as a nurse and taking your NCLEX and passing is what's going to be worth it. So, Your power's out. That stinks. While working in long-term care, you ever see med aides working with the nurse? Do they pretty much just help the nurses give out medications? Okay, so I've never seen medication aides helping a nurse. Where I worked, the nurses were pretty much the DONs, which are directors of nursing. So the directors of nursing pretty much made our schedules and just made sure the CNAs and med techs were doing their jobs. In other nursing facilities, like where LPNs were working the med cart and there were CNAs caring for the patients, I never saw the nurses helping the CNAs. And if I ever worked in long-term care before my med pass, or if my med pass was over, I would always assure my CNAs that I was there to help them, because CNAs are the backbone of healthcare. They go through so much. Been there, done that. I know the struggle. And CNAs do not get enough credit for what they do, and they deserve to be paid so much more than what they get. I remember when I was a CNA, I had to beg to get $10 an hour, and I was working the assisted living side by myself. So that was 30 plus patients by myself. Yeah, it was assisted living, but you can't leave them in the shower alone. Some of them needed to be fed. And then on the memory care unit, I would be responsible for, 16 people by myself, because people were always calling out, and then I would have to take on their assignment too and make sure that people were properly cared for, bathed, their briefs were changed. I put all of their like bacitracin cream on, or if they had wounds on their bottom, I would have to put on the cream for that. And CNAs just don't get enough credit for what they do. Like, there's so many more jobs that get paid more than a CNA, and it's not even that extensive of a job. But you would think a CNA caring for someone who is in hospice or needing rehab or something like that, we're there to help them regain their life. We're there to help them live the fullest life that they can live and take care of them, because, no one else can, and then their family can only visit. We're like their second family, and we get paid crap. So, been there, done that. I'm a telephone operator for 4 years in peds. Yes, that's my Instagram. Okay, I'm a telephone operator for 4 years in peds. They do tuition assistance, but I don't know if they will work with my schedule. So you can always ask. You can always ask if they'll work with your schedule. If not, you have to do what's right for you. If you're not happy where you're at, just like the doctor I work with now. He's going to be leaving soon because he's doing something that's going to make him super happy that he's always wanted to do. And he always says, you don't stop until you're happy. And when he said that, I was like, that's kind of like a sign to get my bachelor's. Like, I've always wanted my bachelor's of nursing. So I was like, okay, maybe I'll work here 3-4 years, pay off some bills, and then really think about going to the program I want, because the program I want to go to at the college I want to go to is full-time, Monday through Friday, 8 to 4:30, occasional weekend clinical. But it's all hands-on learning, and the college I want to go to is the company that I already work for, and they do tuition assistance, so I would have to somehow find a way that they would work with my schedule. But that's later on down the road. I still have debt to pay off and save up some money and get an AC unit because mine's broke and all that good jazz. But you definitely always want to always communicate with your job. A lot of the times, your job is willing to help you. Your job should understand that you want to move up in life. You don't want to just work a job to work a job. You want to be able to provide for you, your family, have a good retirement, learn skills. If you're happy where you're at, stay where you're at. But if you're not happy where you're at, you need to move up. You need to do what's right for you. Here in North Carolina, in LTC, we have CNAs and the med aides that help the nurse with the med pass. Okay, I've never heard of that. But again, that's Carolina. But here, all of the long-term care facilities we were at, there were CNAs working and LPNs on the cart. And the reason there were LPNs on the cart is because the LPN had to do wound care if there were any wounds, or if they were on like IV antibiotics or they had an IV, you had to be able to start and stop the IV or administer a new IV and record that. And I don't know if MedTech training down there allows them to do bolus feedings or start and stop an IV. Here in Virginia, they can't do that. So that's why our long-term care only wants LPNs working the cart. And that's why there's so many long-term care facilities and rehab or assisted living and dementia units, because the assisted living and dementia units can have CNAs and med techs because the nurses come from the outside and come in and do the wound care, trach care, whatever they have. The LTC and rehab, they want the nurses there because it's in their scope of practice to do all the things that need to be cared for. They don't have to call outdoor companies to come inside and care for that patient. But again, North Carolina is probably different than Virginia. Virginia has all kinds of laws because we're a commonwealth and there's a law against everything. So a lot of stuff can be different. I just want to make sure I got everybody's question. Power's out. Yeah, so I answered everybody's question. I'm going to post this for anybody who needs to rewind and listen or do whatever. But I just thought I would hop on and talk to you guys and just answer a couple of questions. And this all started with my new subscriber who wanted to know, you're welcome, who wanted to know how to negotiate pay as a new practical nurse. And basically it goes by your skill set. It goes by the company, what their protocols are in place. And like I said, my first job out of nursing school, starting out base pay for an LPN was 15 on the dot, nothing more, nothing less. You had to prove yourself. And by the time I left there, you're very welcome. I love sharing my journey with you guys. I love sharing my experience with you guys. But yeah, my job, I truly appreciate all your advice. Yeah, I'm here to help. I want people to know what they're getting into. Nursing school is not easy. If it was, everybody would be a nurse. And don't let people degrade you just because you're an LPN. You're a nurse. You took the same type of state board that an RN does. You're caring for people just as much as a registered nurse. And honestly, RNs have so much more paperwork than an LPN. And that's why at my facility, the MAs, when they're called a nurse, they're like, I'm not a nurse, I'm a medical assistant, because nurses have more responsibility. We have a lot more to do. So I just think it's funny when I hear them say that and they're like, I'm not a nurse, I'm an MA. So you are going to have a lot of responsibility. You are going to be stressed out. You are going to experience things that you've never dealt with before, but that is what your colleagues are for. If you don't ever know the answer to something, you have to ask questions. I still ask questions. I've been there a month, and they know I'm learning, but I've been on my own since like week 2, just because I pick up things fast and I just go with the flow. If I do something and it was wrong, they tell me and I learn from it. You always have to learn from your mistakes. Do not let mistakes get you down, especially when you're starting a new job in a new field or at a new facility. I'm gonna get my drink because my throat is getting dry. But don't let any of that get you down. People make mistakes. You're human. Nurses make mistakes. Everybody makes mistakes. You're never going to be perfect, no matter how long. Yeah. CNAs, like I said, you don't get enough credit for what you guys do. And I was in that boat. I had family members yell at me. And a lot of times, especially if the patient is declining, say cognitively, they have dementia and it's developing into full-blown Alzheimer's, or if they have Parkinson's and they're moving too slow, sometimes the patient's family don't put in the effort to understand what's going on with mom, dad, grandma, grandpa, or uncle. And they're just like, oh, well, why is she walking like that? Or why won't my dad feed himself? Okay, dad isn't the same 24-year-old he was. Dad isn't 50 years old anymore. He's 83. He has dementia and he has aphasia. He has difficulty swallowing. So that's why he's on a pureed diet. Or, mom is walking so slow and shuffling her feet and unsteady gait because she has Parkinson's disease. She can't help that. Sometimes you have to be the one, in your head. I know in y'all's head, you're saying, good God, what did I do to deserve this? Why is this person so mean to me? I've said it 1,000 times, and I still go through that. I have rude patients all the time. And basically, my rule of thumb is to just kill them with kindness. If they're rude to you, I still, hi, I'm Amberly, I'm going to be your nurse today. And if they grumble, I'm going to be like, I'm going to take your temperature and then I'm going to get your blood pressure. And as soon as I'm done, my doctor will be in to help you. You know, you just have to kill them with kindness. And don't ever let somebody take you out of your professional character. Don't let somebody bring you out of your element, ever. If you ever feel threatened by a patient or they are just so rude or so disrespectful to you, definitely tell your manager. My facility, if you're rude, if you go that far out of character and we document and enough people document it, you're discharged from the practice. You are no longer allowed to see us because we don't tolerate that. We don't tolerate mental abuse or physical abuse, emotional abuse, none of that. And that's basically what it is, you know? And especially when someone tries to think that they're above you and they don't have the right training and they want to make you feel down about yourself, yes, you kill them with kindness. You know, some people just really feel like the world revolves around them or it revolves around just their family member when they don't understand um, that you're taking care of more than just dad or just mom or grandma or grandpa. There's more than one patient in the facility and you're trying to do the best you can. You're only one person, and the one thing I tell people I work with is you work the job, do not let the job work you. You are one person. Don't be trying to do the job of 4 and 5 people. You do what you can. At the end of the day, I did what I could. You know, you tried to make things work. You tried to do this. You tried to do that. And what will be, will be. One more question. How do you handle coworkers gossiping about you, stressing you out? So I don't stress over gossip. I can't stand people who gossip. And it goes on at my job now. And I don't listen to it. I don't participate in it. And I basically focus on myself. The way that my job is set up, the nurse's desk is in the same office as the doctor. It's in the doctor's office. I sit at my desk all day. If I don't have patients and I don't have nurse visits, or if I don't need to run to the lab or do anything outside of my office, I'm in my office and I'm refilling prescriptions. I'm calling patients that need to be called. I'm faxing paperwork. I'm getting my doctor to sign and fill out paperwork that needs to be signed and filled out. I'm focusing on myself, my job, my patients, my doctor. If I'm happy and my doctor's happy, everything is smooth. Sometimes you have to separate yourself from people who are that low, that like to act like it's high school and still gossip. You know, I'm 26 years old and a lot of people say, oh, you're so mature. I've always been this way. I've always been mature. I've never liked gossiping. If I have a problem with somebody, I say it to you. I don't say it about you to someone else. And not in a mean way. You know, if I feel like you have disrespected me, I'll pull you to the side and be like, look, I really feel like what you just said to me was wrong. If people are gossiping about you and stressing you out, like, I don't know the whole situation, but you could always tell, like, your director of nursing or your manager or anybody else that's higher above you, like, hey, I've heard them talking about me and I really don't appreciate it. Depending where you work, you could go to them directly and just be like, hey, I really don't appreciate you talking about me. Or just go to your manager and be like, hey, I've heard this come out of so-and-so's mouth and I don't appreciate it and I need you to get this situation under control before I do. That's what I would say. And I'm not a confrontational person, but I also don't like to put up with crap. And especially when you're an adult. When adults gossip like children or like they're in high school, it's like you're 30, 40 years old. I used to work with CNAs and med techs that would gossip about CNAs. Like, they would tell me I'm working too hard. You're never working too hard in the nursing field. If you're caring for people, you're caring for people. You know, I'm not the one sitting on the couch in memory care watching TV and eating when you're supposed to be up caring for people. That was never me. I've always done me. My job is my job, and I focus on my goal. When I walk in to work every day, I just tell myself, like, my goal is to keep my doctor happy, keep the rooms full, and focus on myself and my job. That is my sole priority. I ignore it, but go home and cry. I'm 25 years old, always been sensitive. Yeah, so don't cry about it. And don't take that the wrong way. Like, I know I just said that pretty bluntly, but don't cry about it, because that is not going to solve the problem. And that is not making them realize that they're hurting you. I don't know why they're gossiping about you. Maybe they're gossiping about you because you're working your butt off and they're lazy, or, you're doing things differently than the way they would do it. As long as you're doing your job, and at the end of the day, you can say that you did your job and that's all, I wouldn't care. I really wouldn't. I wouldn't let them get the best of me. The only person you need to care about is yourself. Let me see something. Yeah. You're the one in North Carolina. Yeah, so you definitely need to ignore it, but you shouldn't feel like you should have to cry about it because they're hurting your feelings that bad. I would definitely speak to your manager or your unit manager, whatever they do, director of nursing. Yeah. I wear makeup every day and always fix my hair. That's what it is. So what? I wear eyeliner at work, and half the time, I mean, I know y'all are probably surprised my hair isn't up in my crazy little bun thing, but I don't know. I don't know. Being a CNA and then going through nursing school, I built a backbone that I just don't care. I worry about myself. I worry about my family. As long as my bills are paid and I take care of myself, that's what matters. The fact that you put in an effort to look good every day and your hair's done or your makeup's done, kudos to you. I literally roll out of bed, 6:30, throw on some eyeliner, brush my teeth, deodorant, keep it moving. That's why half the time my hair, especially when I'm doing live videos, is just up and it looks crazy because I don't care. I focus on myself. And, I know a lot of people have talked about me because I've gained so much weight. Duh, I look at myself every day. I know I've gained 40 plus pounds, but I've also been going through a lot that you probably don't know about. And when people say stuff behind my back, or they'll be like, you really gained a little bit of weight. I'll be like, I didn't gain a little bit. I gained a lot. I gained 40 plus pounds. And you know why? I lost my dad very unexpectedly. And then after that, my plumbing took a crap. In between all of that, my AC finally bit it, and I gotta buy like a new unit, which is $5,000 or whatever. I haven't had anybody come out to assess it because that's the least of my worries right now. In between all of that, I'm working my new job. I'm learning how to do my new job. I'm trying to take care of myself. I'm trying to take care of my cat. I'm trying to take care of my household and pay my bills. That's my priority right now. I don't care. As long as if I'm fat and happy, I'm fat and happy. You just have to, if you're happy with yourself and you like the way you look in the morning with your makeup and your hair done, so what? Maybe you should tell them to put in the effort to look better. There's always something. There's no reason to cry because these people are talking about you because you like the way you look with your makeup and hair done. Absolutely not. And I work with tons of nurses sorry, my nose is itching. But I work with tons of nurses that, they'll do their hair or they have long nails, even though we're not supposed to have long nails. Like, I rarely have my nails done. But they'll have their nails done. They'll have them eyelash extensions or whatever they do. A lot of the girls get new weave or new wigs, whatever they do. And I'm like, oh, girl, look at that hair. Oh, girl, look at them nails. I'm always complimenting them because I honestly envy them. I wish that I could take the time to do my hair in the morning or take the time to do my makeup and look good or get my nails done. I would love to get my nails done, but I use my hands so much at work or at home when I'm working out in the garden or lawn mowing, whatever. They just get messed up. So I'm not girly enough to keep my nails done, and I wish I was. I envy people like that. I envy people that wake up an hour, 2 hours early before they even need to start getting ready for work and get ready for work and look good, when they walk in the door. I really do envy people like that. I've never been like that. High school, when I went to community college, nursing school especially, they were lucky if I even put on makeup, eyeliner, at the minimum, mascara. So you do you. You worry about you. You are the only one that's going to take care of yourself. You don't need to worry about the gossip. That gossip is not helping you. If something doesn't help you, you don't need it in your life. You need to just do what you're doing and ignore them. Don't go home and cry. Own it. Yeah, I did my makeup. Yeah, I do my hair. Your patients, I'm sure, still love you. You're doing your job well. They don't pay your bills. Don't worry about them. Period. The end. It's that simple. That was a rant. That makes me angry. Especially if these girls aren't your age and they're like older CNAs that should know better than to gossip about someone. It's ridiculous. And like, I don't know like how long your hair is, but if I was like walking past them, I would flip it and just be like, yep, going to bathe so and so, you know, just I just don't care. You know what I mean? I wouldn't even pay that any mind, honestly. Crying, you need to save your tears for something that's worth crying over, because it's not worth it. It's long, yeah, I'd flip it. Be like, yep, so I just got done doing this and I'm going to bathe so and so. And then like walk into the other room and do what you gotta do. Just don't worry about those people. They're not worth your time. And at the end of the day, especially if they were to know that they're getting to you and you're crying, they won. You don't want them to win. They need to grow up, basically. Yeah! My cat's meowing. But I had really fun chatting with you guys. I've never had that many questions in my life on one of these lives. But I've said it before and I'll say it again. I love doing the lives because everybody has different schedules, and then they can rewatch this and really get to see, you know, all the questions that you guys ask, and then I answer them. They could just rewind it and see the answer. You guys can follow me on Instagram, and if you have any questions there, you can ask me. You can ask me on here. Like I said, any classes you guys take and you need help, you're very welcome. Any classes you guys take that you need help in, I'm here for you. And I've told you before, you know, I've been there. I've done the journey, and the nursing school journey is going to open up your eyes to so many different things. You're never going to realize that you could be so stressed out but love something so much. And when it's all over, like literally, I still remember like the last clinical. I still remember our last class. You're very welcome. The last class, and then like that last week where we were doing forgot what leadership. That's what they call it, where you learn to be a nurse. You learn to carry yourself and apply everything you learn. And we did like simple little projects here and there just to get an easy A. But we took that last class, and then we graduated that August. I think it was August 14th, 2016. I graduated. It was just like, holy crap, it's over. Like, no more care plans, no more projects, no more clinical at 6 a.m. Like, I get to sleep in after this. And I did. When I graduated nursing school, I think I took like a month off. I was like, I'm done. I'm taking a month off. I'm partying. I'm living it up. Took my NCLEX. First, we graduated nursing school. I got hired at the OBGYN before I even passed my NCLEX. I gave them my NCLEX date because you can work with your 90-day letter. Passed NCLEX on the first try, and I was like, boom, I got this in the bag. It was all worth it. And still, to this day, I'm learning new things. I'm meeting a lot of new people. I'm loving it. And, you know, there's some people that are born to, like, play the guitar like Jimi Hendrix, and it's like, I was born for this. I was born to help people. I was born to nurse. And I think nursing just makes you such a more well-rounded person. And if you were shy like me, if you're shy now, or if you were shy in high school or middle school and you've never really come outside your bubble, I feel like nursing is a good way to take advantage of being an outgoing person, because I'm so different now. And I'm proud of the person that I've become. I used to never talk to strangers. I used to like clam up, and I'm just like, oh my gosh, I used to hate being in Walmart around all these random people I don't know, or if I was on an aisle and someone random would come down that aisle, I'm like, oh my gosh, I would get so weird. Now, I'm grabbing my chips and I'm keeping it moving. Hey, how are you? How? And if they're looking at me, hi, how are you? You know, don't stare at me. It's weird. It's like, what, can I help you? Or like today when I was checking out, you know, I liked her shirt. I'm like, I really like your shirt. Oh, well, thank you. And then she asked me like about something I had in my cart, like these chips, these little rice cake chips. I'm I'm like, they're pretty good. You know, I like them because they're crunchy and I'm trying to lose weight. But nursing is just such a great opportunity, and taking the first step of being a CNA and then climbing the cobblestones to reach your way up to, you know, RN or BSN or having your master's, or even if you just want to stop at LPN because you're happy, you did it. You did this for you. You have to do it for you. You can't let other people talk you into doing a career that you don't want to do. You know, if you feel like you should be a nurse and other people are telling you to be an engineer, you have to do what's going to make you happy. You're the one that's going to be going to work every day at this place. You're the one that's going to be doing the job every day. So you have to make sure you're in it to win it. And I've told you guys, vomit, blood. We removed a skin tag the other day, and then he pushed it and some pus came out. If you can't handle stuff like that, yes, I can do a video on healthy snacks to take to nursing school. But if you can't handle pus or warts or cysts, popping zits, throw up, vomit, feces, urine, because we do a lot of urine samples, especially like UDSs, which are urine drug screens, you just can't. You just can't be a nurse, man. I mean, you can be a nurse, but you're going to see that stuff, and you're going to have to get a coworker to come in and help you, because you'll see a lot of it. And CNAs already know what I'm talking about, because you're bathing people, changing briefs, feeding people. Y'all already know the deal. If you're a CNA, you're probably going to love being an LPN, because I was a CNA and I loved being a CNA, but the pay sucked, and I love being an LPN. When I go to work, I'm smiling all the time. I'm happy. Today did test my patients and it stressed me out, but I'm still smiling. I'm still excited to go to work tomorrow and see my patients. So I think this is like the longest live. No, this isn't the longest live. Maybe it is, but I enjoyed answering y'all's questions, and you can follow me on Instagram and ask me questions there, and ask them here and I'll answer them. Someone just requested a healthy snack video for nursing school, so I'm going to get my list together and tell you guys that. Obviously, Dunkin' Donuts isn't a healthy snack, but like I said, I'm already fat and happy, so be it. But I really do enjoy telling you guys my experience and answering your questions, because I don't want you guys to feel like you're alone. I don't want you to feel like you're so stressed out to the point that you want to quit, or that it's not worth it, because it is worth it. You just really have to stick through it. Yes, I will see you guys next time. I'm done blabbing, and I will save this to my page for anybody that wants to replay it or share it or do whatever. So I also need to plan another giveaway, because that was fun. But yeah, that's something else. So I'll probably do another video. I'll try to go live like once a week around 7:30ish. And I'll try to come up with ideas to talk to you guys about, or if anything exciting happens at work, you know I'm going to tell y'all. So I really enjoyed talking to you guys, and I really enjoyed talking to you guys, and I love answering your questions. So if you guys think of questions when you're at work or in the car or anywhere, and you want to write them down and bombard me with questions next live, do that too. I'd rather answer your questions than you go without having them unanswered. So peace out. It's great talking to you guys.